Lee Health Orthopedic Surgeon Dr. Tobin Hanson says one of the most common problems people 60 and up deal with are hip problems and hip arthritis.
As the hip wears out, the rotational component of the hip can really suffer. So number one, people can't be as active, but even everyday activities such as tying shoes, reaching down to pick up something off the floor can really be affected.
The good news is there's a variety of different treatment options available.
Whether it be cortisone injections, physical therapy, and then in the end, hip replacement if needed.
A total hip replacement would depend on severity, but in the right population, it can be done as an outpatient procedure.
The joint is truly removed, so there is no more arthritis, and you can actually get up and walk on it the same day, put weight on it, work with therapy, and certainly when the surgical pain goes away, kind of start to ease back into things that they've enjoyed.
While it may take a few months to get back to where they once were, Dr. Hanson says he's happy to help restore function in his patients.
Usually within 3 to 6 weeks, most people are saying, wow, I'm really glad that I had this. And then it's just a matter of rehabbing, getting the strength back, getting the stamina back, and get back to living life, as some people would say, get back in the game.
You can learn more by searching for orthopedics on leehealth.org. For Lee Health, I'm Devin Turk.